It's hard not to interpret the comments made by the president of the Australian Society of Plastic Surgeons, Nicola recently, as an attack on skin cancer doctors in what seems to be an attempt to defend their patch rather than working to tackle skin cancer collectively. But it seems the society appears hell-bent on undermining public confidence in the great work that skin cancer specialists do. Joining us to discuss the position of the ASPS that they have taken is the CEO of the Skin Cancer College of Australia, Lynette Hunt. Welcome, Lynette.
Thank you, Michael. Good to be here.
Now, it seems like Nicola and her members have their noses out of joint. Is this more about them seeing skin cancer specialists as encroaching on their turf, or is it more about them not holding skin cancer specialists as equals or in the high regard that they deserve to be held?
I think it's more about a misunderstanding and a lack of knowledge held by certain specialists about what actually goes on in primary care across Australia. And they seem to forget that there are thousands of skin cancers or potential skin cancers being excised safely every day in general practices and skin cancer clinics across Australia. And without that work being done by these competent doctors, then it would certainly cost a lot more for the individual patient. It would blow the already long waiting lists for public hospital services completely out of the water, and it would greatly inconvenience patients because rather than being able to go and see their trusted local doctor who's usually close to home and they can go at a time that suits them, they may have to travel a lot further, hang around all day at a public hospital and so on. So I do think sometimes that it comes down to that lack of understanding about what is going on in primary care, which is the biggest sector of our health service in Australia.
Now, the ASPS argue that there are way too many rogues and cowboys out there as a means of defending their position in their statements. And you would have to think it's a flawed argument. Even though you've expressed your disappointment about the comments, they are effectively trying to undermine the public's confidence in skin cancer specialists, aren't they?
I don't think it's a deliberate attempt to undermine confidence. I think, yes, there are rogues and cowboys certainly in the area of cosmetic surgery, but a lot of people get confused about the difference between cosmetic surgery, cosmetic clinics, and skin cancer clinics. I think because the perception is that all of those things have something to do with skin, that when referring to rogues and cowboys, it unfortunately spills over into a perception that that applies to anybody who is providing services about skin, including skin cancer. Definitely, the recently released review by the Australian Health Professional Regulation Agency, which is AHPRA, that has definitely shown that there are some very concerning activities by the so-called rogues and cowboys in cosmetic surgery. But that is not the same thing as skin cancer clinics who are biopsying potential skin cancers. So by pointing a finger at the rogues and the cowboys and saying that, these people are doing dangerous things and they're harming patients, it unfortunately does undermine the public confidence in anything to do with skin and skin surgery, which is a really unfortunate consequence because it's really important for Australians to be vigilant about protecting their skin and looking at their skin themselves and going to see a doctor if they suspect that maybe there's an early skin cancer.
And there's been some frightening reporting around this cosmetic surgeons that are happening here in Australia, and some of them being suspended and struck off. We need to be clear that cosmetic surgeons aren't what we're talking about here. This isn't the skin cancer or plastic surgeons, which are held in such high regard and are in no way connected with the cosmetic surgeons. Now,
the problem is that unfortunately there is no regulation around who can call themselves a cosmetic surgeon. So it can be a doctor who has zero actual training in undertaking invasive surgery, such as breast augmentations or tummy tucks or liposuction or, Brazilian butt lifts, as they're called. These are not simple procedures. These are major invasive surgical procedures that need to be done under general anaesthetic in a properly set up surgical treatment facility. There's a vast difference between that and a doctor excising a suspicious mole or other spot on someone's skin. Those sorts of procedures can be very safely done under local anaesthetic, and they don't have to be done in a hospital grade operating theatre. They can be done in a well set up treatment facility within a general practice or a skin cancer clinic.
Now, we've recently seen skin cancer checks and regular checks delayed and deferred because of COVID, which could have a flow-on effect. We may see a spike, we may not, but we know that there were so many that were happening at a regular rate that didn't happen during that time. Combined with this, the messaging that medical professionals have delivered in Australia about the importance of regular skin checks in preventing and deleting cancer, how can we fix this, Lynette? How can we go forward and go, right, cosmetic surgeons, not what we're doing. The plastic surgeons, they may have misspoke or had their words misinterpreted. How do we get back on track and get people back into getting those checks done by their doctor, by their primary care provider, by wherever they can?
I think patients need to understand that they hold the power, that it's okay to ask your doctor, what training have you done specifically in diagnosing and treating skin cancer, and to also look for a doctor that is accredited. Now, it's a voluntary accreditation program that our organisation runs, but we do now have over 600 doctors across Australia who are accredited by us, which means that they have completed significant additional training and assessment to say that, yes, these people know what they're doing when it comes to diagnosing and surgically treating skin cancers. And that list of doctors is available on our website, and it's also available on a complimentary website that we run called scanyourskin.org. So we recognise that there is a lot of confusion amongst the public about who to see and who to trust when it comes to looking at their skin. So that's why we set up the accreditation program, is to help remove that uncertainty and encourage people to get out there and get their skin checked. There's also information on that website about, well, what happens when you go for a skin check? Because a lot of people are a little bit afraid about maybe the doctor's going to stick a needle in me, or, maybe I have to get completely naked and I don't feel comfortable about that. So there's a lot of information there about what to expect at a skin check and hopefully remove any of that uncertainty or hesitation, because a 20-minute skin check is a really good thing to do for peace of mind. It's certainly much better to spend that 20 minutes or 30 minutes at your doctor than find out much further down the track that you've got an advanced melanoma.
Yeah, and early detection, you mentioned the stats last time we spoke to you, the difference between early detection and that late onset.
Yeah.
you know, we service our cars regularly. We check so many things regularly. This is such an important thing to do for good outcomes. What were those stats again for early detection, Lynette?
If a skin cancer is diagnosed in the very early stage, sorry, this is specifically a melanoma, which is the very deadly form of skin cancer. If it's diagnosed at stage 1, the prognosis for survival is up around 99%. So it's very easily and successfully treated at that early stage. Whereas if it's ignored and it's not diagnosed until stage 3 or 4, the survival rate after 2 years can drop to as low as 35%. So a huge difference. And a simple thing like getting your skin checked can be the difference between those two outcomes.
Yeah. And I note now there's even some treatments where surgical removal isn't necessary. We even have a cream now where we can have topical cream that can remove them.
Correct. That doesn't apply for melanoma because, as I said, melanoma is the bad guy, the nasty, really nasty melanoma skin cancer. Those ones always require surgical removal. But other types of skin cancers, and in fact the ones that are much more common, and people may have heard of things like basal cell carcinoma or BCC and SCC, those ones in their, again, early stages can be successfully treated with creams. And also there's now options for people to use light therapy and radiotherapy. So there's a whole range of different options. So people really shouldn't be scared about seeing their doctor for skin cancer treatment and diagnosis.
Great. So there you have it, folks. If you're listening, get checked. Please just get checked. So Lynette Hunt, the CEO of the Skin Cancer College, get to your doctor, get to your plastic surgeon. They all work hand in hand. Neither has the high ground on this. We just need to work together.
Can I just clarify too, Michael, that sometimes people are confused about, well, why do some people get referred to a plastic surgeon if you're saying that GPs can treat it? GPs can treat successfully most skin cancers, and particularly those at an early stage. However, if a skin cancer is more advanced, or if a skin cancer has occurred somewhere on someone's face or a difficult area like in the corner of their ear or the corner of their eye, that's where a plastic surgeon has that extra expertise to surgically remove those skin cancers, on making sure that they don't, first of all, interrupt the function, so that, you know, they're not going to damage anything on the person's face, and also to try and preserve the cosmetic appearance of that person as well. So just wanted to clarify that.
And we would be almost certain that any GP that had one of those limiting factors wouldn't overstep their abilities. You would be referred off to one of those plastic surgeons.
Absolutely. An ethical, responsible, well-trained GP will know their limits and will talk to their patient and will recommend that they refer on.
Great. All right, Lynette Hunt, thanks so much for your time.
Thank you.